So, Dr. Monk, thank you very much for coming here and joining us.
Oh, thank you for having me.
The first question I wanted to ask, I know one I ask myself is, what is maternal health? I've heard it kind of referred to in popular culture, but I've never actually heard it defined, so I'd love to hear from you what it means.
Yeah, absolutely. I think a lot of people don't know what it means, and generally we are referring to the pregnancy and postpartum period.
Okay.
So the time when we think of women as becoming mother. So that's the maternal health, mental health term that gets used.
When I met yourself and Murad Farid from Square Roots, I was kind of shocked that you guys are in this space and the urgency with which you're approaching this issue. There's a problem in maternal health. I wasn't aware there is one. Can you tell us a little bit about the issues?
Yeah. When a woman is not doing well, and I'm going to be focusing on her mental health, her mental well-being, as in stress or depression, obviously that's a concern for her, for the individual, as it would be for any individual. And we need to be getting someone like that the help they need. But when it's a maternal mental health issue, there's not only the woman being affected, but we have potentially two patients, at least two, I should say. The woman and then her baby or her future baby, because even during pregnancy, how she's doing in her mental health, we're learning can actually be affecting the baby before birth.
Wow, that's amazing. So can you talk a little bit about the connection between the mom and the baby? I think some of us have kind of a general understanding, obviously the two are kind of connected in some ways, but the work you're doing particularly on the baby's neurological development is fascinating to me. So tell me a little bit about the connection.
Thank you for saying it's fascinating. It is to us, those of us working in the area too. I want to pull back and just really start with the idea that I think most people have the idea in mind that postpartum, that if a woman has a significant postpartum depression, that she's not going to be, again, she's going to be suffering and she's not going to be available to her child to harness.
And what is this postpartum depression?
Yeah, that period when the mother-infant relationship is beginning to get established in their rhythms back and forth with each other, if she's unavailable emotionally and also even physically to provide for that baby, there is a neglect that's going on, and it doesn't even have to be the physical neglect as in not getting fed. That would be very, very extreme, but even just being emotionally available for the smiles, the comfort, the attuned responding is going to get that mother and baby started on a really non-optimal trajectory and affect that baby's development. So just briefly, it's been established that postpartum depression is associated with a risk for delays in cognitive development. And we really see that in children. But there are a lot of us doing research that suggests that the prenatal maternal health is also affecting the fetus, as you alluded to in our work looking at brain development. So I'll give you a couple of examples of what we've been finding. I want to actually start with the fetus before I get to the baby's brain, because we can see in fetal behavior differences in how the fetus responds to stimuli. So this is in utero, based on whether their mothers are depressed during pregnancy or not. And really the short version of a bunch of papers we've done and some other groups have done is that the fetus is more reactive. And we actually look at this in their heart rate. It's hard to ask the fetus questions. We don't have a lot of ways to get answers, but we can see in heart rate reactivity to novelty that those babies in utero whose mothers have depression are already more reactive to the world. Now we've taken that out, as you've said, to the brain development. I mean, any response we have in our heart rate is determined by the brain stem, and also some cortical functioning in a more advanced part of our brain. And now we've taken that out to more directly look at the baby's brain development. And we and other groups also are doing this work. In one of our papers, we've seen that babies exposed to depression during pregnancy, and again, untreated depression, just about 4 weeks after birth, we have them go under an imaging paradigm. They're just asleep, they're not sedated. And what we've seen is in this resting state, those babies, again, exposed to maternal depression, have a greater connectivity between parts of the brain that are very involved in regulating emotion. The amygdala is a term that people often hear of the brain that's involved in emotion regulation. And they have an increased connectivity, and you might think, oh, increase, that's a good thing. And we don't really know good or bad, that the brain is so complex. But what we do know is that they have the adult pattern earlier. So as if they're getting shaped in utero to already be ready for needing to respond to challenge. And we think, and again, based on what we and other groups have been doing, that along with our fetal heart rate data, that we're seeing a kind of accelerated development in being exposed to depression or other kinds of toxic stress in pregnancy, that may be part of an evolutionary process that actually gets the baby ready for a very stressful, dangerous world.